Hello, I'm Dr. David Ott, and I would like to welcome you to Banner Surgery Center Gateway Orthopedics, or what we affectionately call Gateway Surgery Center. Banner Surgery Center Gateway Orthopedics has a comprehensive joint program where you will experience a concierge level of service from scheduling your procedure throughout your recovery at home. You will have 24/7 access to providers during your recovery to address any concerns that you or your family might have. Your surgeon chooses to perform surgery here because of the great team and the knowledge that our patients are being provided the best quality of care. We are confident of your outcome from your surgery not only because of your surgeon's expertise, but because of the environment which we choose to operate on. Don't just take our word for it. Our joint coordinator, Maureen, will give you a tour of the facility and introduce you to your team from door to door so that you will feel at home when you arrive on the day of your surgery. Have a great recovery.
Hello, we would like to take this opportunity to welcome you to Banner Surgery Center Gateway Orthopedics. We are committed to providing you with excellent care every step of the way. This video will take you on a tour of the facility so you can get a feel for where your experience will take place while meeting some of the new faces that will be taking care of you along the way. Please remember to follow the guidance of your physician and your joint replacement coordinator about what to wear, what medications you should take, and what to bring for check-in. When you arrive at the entrance, you will be greeted by our patient coordinator. You will be asked to wash your hands and take a seat in the waiting area until you're called to the desk to start checking in. The registration process will take approximately 5 minutes. Please be sure to bring your photo ID, your insurance card, and payment method if needed, as well as your advance directive if you choose to have it on file. The contact information for your ride home will be verified to be given to your surgeon so that he may contact your family when your surgery is complete. You will then have an ID band placed on your wrist, and you will be asked to please take a seat in the waiting area until it's time to go into pre-op. A nurse will escort you to the pre-op area where your name and date of birth will be verified, and you will be weighed. You will then be taken to a private bay where you will change into a hospital gown and a surgical cap, provided with a warm blanket for your comfort, and prepared for the next step in your journey, the operating room. This includes taking your vitals, signing your consent, having your surgery site marked, and receiving post-surgical information. But don't worry, a written form of the information will be provided to your family after surgery, so please don't feel that you must remember everything. Please be sure to have all of your questions answered before you sign your consent. Once you're fully ready and all preparation has been completed, your operating room nurse will come to you when your surgical team is ready and take you back to the operating room. She will verify your name, date of birth, that the correct surgical site is marked, and the correct procedure is documented. Your operating room nurse will be your guide and will stay with you all the way through until your operation is complete. Upon your arrival to the operating room, your team will be there to welcome you. They will introduce themselves to you and explain their roles. You will be transferred to the operating room table. You will be connected to equipment that will closely monitor your vitals during your procedure, and your anesthesiologist will begin the anesthesia process. The length of your surgery depends on what procedure you will be having, and when it is complete, you will be taken to the post-anesthesia care unit, or PACU. Your time in the PACU will depend on your individual recovery time. When you arrive in the PACU, you will be awakened slowly and gently. Once your nurse determines that the effects of the anesthesia has worn off enough for you to stand and walk safely, you will be assisted to walk around the unit with the use of a walker and a gait belt. When you're ready for discharge, you will be assisted to change into your own clothes. Remember to wear something that is loose-fitting and comfortable that will be easy to put on. Your PACU nurse will keep your family informed and let them know when you're ready to go home. They should pull their vehicle up to the north entrance where they dropped you off, where your nurse will take you via wheelchair and assist you into the vehicle.